if you're a CrossFit athlete or do a lot of high intensity training throughout the week, I want you to make sure that you listen up, because I'm going to talk about today some of the dangers that can happen from doing too much high intensity work too frequently. So, and this can be for anything, whether it's CrossFit, whether it's other types of high intensity boot camp classes that are out there. I am always, especially in the context of rehab, but I'm always preaching to people, you should not be trying to go 4 to 5 days a week to failure for weeks on at a time. The human body is just physically not able to properly recover from that consistent high level of stress and intensity for a prolonged period of time. Listen, if you're taking a deload every fourth week at the end of every month, different conversation, but even still, from my experience of working with people, this is really where issues tend to pop up from a rehab standpoint. Injuries will come up. A lot of times people just get a lot more just progressive aches and pains. At the end of the day, it just comes down to their ability. They can't recover as well, especially say if it's the first time that you're jumping into a new type of workout. You're excited. That first week, you might be feeling great. You went 5 times a week. You were crushing those workouts. The second week, you're like, I'm doing okay still, but I'm still noticing I'm a little bit sluggish or whatnot. Usually by that third or fourth week, that is when you get to class and you're just like, man, I feel like I have nothing left in the tank right now. And more often than not, people try to push through that, and that's where these injuries tend to pop up that I see a lot in the clinic. And it's really at that point just an educational moment for myself and the patient, the athlete I'm working with, of finding a way to help navigate that return back to those high-intensity classes, whether it's into Olympic lifting, anything, or CrossFit, anything like that. So this is really just something that I really try to preach to not only current patients we've seen, but all those members in the community of you maybe, if anything, a good general rule of thumb for people, you take 2 to 3 workouts a week that you're really going hard, RXing. Listen, this is different if you're going to compete in games or any type of like high level competition like that. The intensity you're gonna have to train with is gonna be much higher than other individuals. But for the most part, if you take 2 to 3 workouts a week out of the 5 times you go, where you are really pushing the envelope in that regard, trying to have at least 24, maybe 48 hours in between those sessions if you need to, that's going to leave you in a really good spot to help with overall fitness, but it'll help you get stronger in the meantime. If you have too much high intensity stress too frequently, your body is just going to get completely just shot in a downward direction, and you're just physically not going to be able to recover. And we need that recovery to create what we call supercompensation, which essentially is you getting stronger and more athletic, more durable to that response. So in other words, what was once an easy or what was once a hard weight or stimulus should eventually become an easier weight for you to work through by allowing that proper recovery process and your body to adapt to.